It's Dr. Kevin Lewis. I'm the Director of Help to Change within the Shropshire Council's Public Health team. Well, we've been working very closely now for a year and a half with the primary care teams, GP practices, and the community and voluntary sector in Shropshire to try and build a support system for people in their local communities to enable them to live well in their local communities and avoid the risks of disabling illnesses in later life. And we've been calling this programme Healthy Lives, and it includes social prescribing, which is a new approach to helping support people with non-clinical needs that don't necessarily need a doctor or nurse to help them. We're exploring new ways of supporting people in their homes and helping people to stay well for longer in their communities so that they avoid the disabling illnesses that are happening with increasing numbers of people in later life. I think it's been a great opportunity to network and to find out about new opportunities in technology that will help support the work we're doing in public health. We're very keen though to realise the human dimension of things. There's a lot of need for social contact in people's lives. There's a lot of social isolation that's a factor in people's lives, and we're trying to understand how technology can interface with what influences people's behaviour, what supports people in their day-to-day lives, to give a more personalised approach to supporting people. Social prescribing is about helping to support people who might be at risk of future illness and be more proactive in giving them the support they need to avoid those risks and to live healthier lives. And we want to do this by connecting people largely to a range of non-clinical supports in their community. It might be housing advice, it might be debt advice, it might be physical activities, it might be dancing, it might be sports, it might be a whole range of different things offered by the third sector, the voluntary and community sector in communities. But it's all about giving people access to the things that will change their lives for the better and help them avoid risk. So we have ways of working with general practice to identify groups of people who may be heading in the wrong direction, people who have, for example, pre-diabetes, who need to look at their diet, look at their weight, look at their physical activity, understand a little bit more about things that are going on in their community that would help them understand their condition, connect them to other people with similar conditions and help them support each other. So this is very much about creating a new system approach to keeping people well. And it's a preventive approach. It's really about avoiding services being needed later on by getting there early and giving people the help they need to change their behaviours maybe, or to change their social situation, to get the advice and support that they need to move on in their lives. And this is something that is being widely embraced now by GPs and primary care nurses, pharmacists. So it's creating a new network of support for people, and we've been very lucky in Shropshire to have very strong support from the voluntary and community sector, who are very well organised in Shropshire. So we have huge assets to draw on. We have a fantastic rural community for people to enjoy. We have fantastic third sector provision, but we want to make sure that those assets are getting to the people who really need them. It's about making sure that we connect together the various assets that exist in our communities and to join the organisations together in partnership so that people get a service that meets their needs as an individual and personalised way, but also a service that helps support them in a joined up way, so they're not having to go to different organisations for different bits of their care, because people don't want that. They want to get one place where they can get supported and they can hear and get the advice they need. So we're trying to achieve that through working in partnership across the system. There are a variety of referral routes into this. We're scaling this up across the county. It's not available everywhere yet in Shropshire, but there are centres of the county where it is available. And we're working very closely with general practice, who are referring into this service, but also with social care and with the fire and rescue service through their fire safe and well visits, and with the voluntary and community sector, who often are well placed to identify people at risk and refer them in. So we have a variety of routes of targeting the services to the people who would most need it, and making sure that they get offers of support proactively rather than waiting for them to reach a crisis. At the moment it is by referral, because we're very keen to make sure that this is reaching the right people, the people who have the most need, the people who have the highest risk. But over time there'll be a wider range of routes into the service, but at the moment it is mainly through the GP practice.